Meet Iris and Fornax. What Iris and Fornax tell us about the future of the pandemic. I'm Tyrone Bowman. This is Tyrone Bowman Tonight. According to Vox, in the latest data published by the Centers for Disease Control and Prevention, or the CDC, COVID-19 hospitalizations rose 18.8% between August 13 and August 19. Overall, they have been increasing since July 1. And in the last week, there was a 19% increase in locations reporting their highest levels of SARS-CoV-2 ever in sewage wastewater. And that's despite a decrease in the number of cities reporting the virus in their wastewater. Pardon me while I just delighten here. This is all to say COVID-19 appears to be making a comeback. And what's more, this summer and fall uptake coincides with, but may not be caused by, a new dominant variant of the virus taking hold in the U.S. It's called EG5, unofficially nicknamed Irish, and the CDC estimates it's causing 20.6% of current COVID-19 cases in the country. And it's on the rise since the beginning of July. EG5's prevalence has increased 12.7%. And it's not the only variant making waves. The second most dominant variant is FL 1.5.1, or Fornax, at the beginning of August. This variant was the fifth most prevalent, accounting for only 7.1% of cases. It now accounts for 13.3% of cases. Both EG5 and FL.15.1 descended from the Omicron variant, which caused an explosive outbreak in late 2021 and early 2022. And on August 9, the World Health Organization, or the WHO, upgraded EG5 from a variant under monitoring to one of interest, meaning it believes Iris could pose an increased risk to global public health. Based on its genetic features, immune escape characteristics, and growth rate estimates, EG5 may spread globally and contribute to a surge in case incidence. WHO's EG5 initial risk evaluation report states several countries with rising EG5 prevalence have seen increases in cases and hospitalizations, although at present there is no evidence of an increase in disease's severity directly associated with EG5. Infectious disease experts tell Vox they agree the new variant is worth paying attention to, but are cautious in saying how concerned we should be. Although the EG5 variant apparently has a slight competitive advantage over other strains, and we've seen the number of cases go up slightly and the number of hospitalizations go up slightly, I don't think there's any reason to expect a massive wave like we saw with Omicron, said Rebecca Wertz, an infectious disease physician and a professor of health policy and management at the University of Minnesota School of Public Health. A new COVID-19 variant understandably puts a country ravaged by the virus on edge, but compared to the last 3 summers, COVID-19's impact on the health care system in the U.S. remains low. As of now, if people keep up with prevention efforts, they should be able to stay safe. Ruth McDermott Levy, a professor at the Louise Fitzpatrick College of Nursing at Villanova University, told Vox. I think we should be a little more alert, McDermott, Levy said, of the new variant. There are several reasons it's unlikely to cause as bad of an outbreak as past variants, but I think continue to be vigilant and pay attention. The symptoms of EG5 don't appear to differ much from other Omicron subvariants. Check this out. Infected individuals report cough, fever, chills, shortness of breath, fatigue, body aches, loss of taste or smell, and headaches, among other symptoms. The WHO, or the World Health Organization, reports that EG5 is not resulting in more causes or deaths than its predecessor, the XBB strand of Omicron, but due to a mutation called the F456L mutation, EG5 and FL.15.1 appear to be more capable of outmaneuvering our immune systems. The fact that EG5 is merging quickly suggests that it does have some slight competitive advantages, said Warts. This advantage is likely that it's slightly more contagious or more capable of evading existing immunity, she said. The good news is that this variant likely won't cause as big of a wave as past strains, said Maureen Miller, an epidemiologist with the Columbia University Bowman School of Public Health. That's because there's more widespread immunity to SARS-CoV-2, either from vaccines or natural infection. But still, not everyone is equally protected, depending on when they were last vaccinated or exposed. The bad news is that these protections wane, she added, given winter waves of COVID-19 have historically been the largest. It's vital that people check to see if they are up to date with their boosters. One obstacle to understanding EG5's reach is the fact that there's less outbreak data than earlier in the pandemic. As of August 19, the CDC only published nowcast estimates of the proportion of COVID-19 variants in areas in New York and the western and southwestern U.S. In the past, even as recently as early July, data was available for much of the U.S. As of May 11, the emergency response to COVID was lifted, and that reduces funding for the pandemic resources, said McDermott Levy. She noted that an increase in at-home testing could be contributing to the underreporting. Also, she says, people might just be tired of COVID and therefore aren't reporting cases. But we're reminded it's not going to go away just because we're tired of it. Thankfully, we're not totally in the dark. The U.S. has adopted some new approaches to understanding emerging strains, and we have wastewater monitoring, which is a fantastic way to get a non-voluntary at-home sample of the entire population, said Warts. Wastewater surveillance involves states, cities, and tribal health departments testing wastewater for the presence and prevalence of the COVID-19 virus and reporting this data to the CDC. Despite some variants, overall, there has been a rise in the areas reporting increasing rates of COVID in their wastewater since early June. Across the country, people have started returning to pre-pandemic ways, but McDermott Levy, who is currently recovering from a COVID-19 infection she got from a family gathering, says the current upswing in cases is a reminder that we need to remain cautious. In retrospect, for my own case, I would have asked family members to test before they came. I used to do that, she said. She also recommends practicing health habits, such as giving up smoking to ensure your immune system is as strong as possible in case of infection. All of the same COVID-19 prevention methods still apply, and the same groups are at highest risk for severe infection: older adults, those with compromised immune system, and those with chronic disease, said Miller. People should wear an N95 mask, social distance when possible in public spaces, and keep up to date on vaccines and boosters. Soon, a new COVID-19 vaccine formula will be available. It's specifically designed to protect against the XBB subvariants, EG5 and FL1.5.1, described from XBB, and will hopefully work to reduce the severity of EG5 infections, said McDermott Levy. These shots are especially important for high-risk groups. People should plan to receive their boosters at least a week before, but no more than 3 months before any winter travel plans or large gatherings. Experts Fox spoke to agreed. This is to ensure or peak immunity at the time of possible exposure. The current spike in cases is part of an under-discussed seasonality to COVID-19 infections. That lines up with weather patterns in Miller. When it's too cold outside, people are inside. when it's too hot outside, people are inside, she said, because the virus thrives in spaces where people are in close proximity. This is a problem. Unfortunately, EG5 and other future variants are merely a piece of the post COVID world. But we do have the technology needed to track the various rapid evolution, and that's helpful despite there being less data on COVID 19 cases overall. It's important to pay attention, but also not to get extremely worried about each new variant, said Hortz. This is the way it's going to be and always has been with viruses, and we just don't have the ability to track the genetics the way we do now. Scientists will learn more about this variant in the meanwhile. Be a little more COVID vigilant can help. I'm Tyrone Bowman. Never surrender, never quit.